for their work over the last year, and I'm looking forward to working with all of them in the coming year. I can tell everyone here who sends us submissions and concerns that we do read them and we do raise their issues with ministers. The Labour government can be proud of what it's achieved on health, but we'll keep pushing them to do better. And Conference, I can't leave this stage without adding my little piece for prevention. We are extremely worried in this country about obesity, and we're even now more worried about diabetes, and in particular in children. Well, I know the next debate is education, and I say to the Minister, Ed Balls, Ed, let us start by giving universal, healthy, free school meals for all children. I thank you, and I hope you will be listening.
Thank you, Mary. Can I now see who would like to speak? And I have a young man with a red tie waving 2 copies of the Policy Forum report. There's a woman with a pink top waving, yes, you, sister. And coming round this way, another man with a red tie waving a red thing. Yes, you.
Conference, good morning. Tim Shand, Labour parliamentary candidate in Guildford and proud member of the GMB. Conference, I want to tell you first this morning that I'm delighted to announce that thanks to the landmark report of Dr Darzi and the efforts of the local activists in Guildford, many of whom are in this room, we've been able both to save 2 of our local hospitals that the local PCT wanted to close, and one of those hospitals, the Royal Surrey, has been able to apply for Foundation Trust status to secure its future. Conference, this is Labour values in action, bringing healthcare closer to communities, improving access, making the services more personal, and reducing rather than increasing health inequalities. I want to commend Mary for our focus on prevention. And Conference, this government has put public health, particularly promoting good health and preventing ill health, at the heart of our agenda. This is specifically also on the issue of the prevention of sexual and reproductive health infections and HIV/AIDS, an issue in which I work. Conference, we have done more to invest in improving sexual health services and to modernise clinics and reduce waiting times than ever before. We have created a national programme for chlamydia screening in this country. We are now, from this school year, vaccinating for cervical cancer in schools, which will save 400 to 500 lives per year. And Conference, I'm delighted to say also that the teenage pregnancy rate is now the lowest that has ever been in 20 years. And what do the Tories say, Conference? Their Shadow Health Secretary, Andrew Lansley, talks about personal responsibility. They blame people for their situation rather than addressing the determinants of health. They talk about the role of government, Conference. We know that what they really mean is cutting frontline services and the voluntary sector through their proposed £1 billion of tax cuts. And Conference, what better example do we have of David Cameron's true colours than his decision to defy medical evidence through trying to cut the 24-week upper limit on abortion? This party, the Tories party, is fundamentally unreformed. It cannot and should not be trusted. Conference, I just want to end by saying we should not be complacent. We must continue to push our focus on sexual and reproductive health services and clinics, on education. We are the party that has the bold agenda on public health. As a candidate in Guildford, I will push to highlight that only Labour has a solution for the problems that the people of Guildford face. Thank you.
Speaker, please.
Conference, Jean Waiting, Barrow-in-Furness, PLC. We're now celebrating 60 years of the NHS, and the NHS has had its best years under a Labour government. We cannot afford to let the Tories in. I have a son with a very rare syndrome called Alström syndrome, and at this moment he's 39. We have, at this moment, 45 youngsters with it. You say that's not a lot, but when you look at what they go deaf, they're blind, they have diabetes, obesity, liver, kidneys, heart and lung disorder, and that's just a few. If I stood here and told you everything that was wrong with those people, it'd actually take me more than 3 minutes, and I'm not allowed that long. So 11 years ago, we got Kay Parkinson that started off Alström syndrome UK. We came to talk to this Labour government on the NHS. We received some funding off them, which started off our clinics for our young people. And why we've only got 45 of them? Because a lot of them die before they ever get to 40. We were always told that Sean would never reach 30, would never reach 40. He's 39. Our youngsters are getting better. Their health is better. And under the funding that we've had, we've actually got clinics 3 to 4 times a year when they all go down. Their health is better. We also find different things from different people. We pass that on. Without this funding, most of our children would be dead by now, and some of them are continuing to better health. And that is why we cannot afford a Tory government to take over. We must fight at the next election to get the Labour government in. Your health depends on it. My health depends on it. And there's a lot of people, health depend on this Labour government. Support the NHS. Fight for what we want. We want a good, healthy community. And that is the only way we're going to get it, by the Labour Party.
Thank you. And before the next speaker starts, come up to the rostrum by all means, but I'd like to call 3 more now so they can be getting checked in and keep the flow going. Okay, I'd like to take the delegate at the back waving yellow. The woman delegate in the blue top, yes, waving pink. And over to the other side, there's a woman waving pink paper very energetically. Yes, you, sister. So, okay, well now, if you can get checked in, and if the next delegate can start speaking.
Sam Thomas, Mitcham and Warden, CLP. Conference, I want to draw attention to an area of health that's often forgotten. More people go to their GP about it than any other condition. 40% of people on incapacity benefit have it. 1 in 6 of us is likely to have it at some point in our lives, yet we rarely talk about it. Conference, mental ill health is one of this country's biggest health challenges. People with mental ill health deserve to be treated with dignity. This government does not demonise them. It supports them. Where possible, at home, with their friends and families. Sectioning is the last resort. It should only happen if absolutely necessary. And under Labour, more help will be available for people in our own homes, with new crisis resolution home treatments, and 3,600 more therapists are being trained to help people live in their community. Conference, the last Tory government talked about care in the community, but we all know what they delivered. What they delivered was a lot of in the community and no care. And now in 2008, the latest Tory policy papers. there is still not a word about mental health. Nothing.